I decided to accept this occasion for what it's supposed to be. That is to recognize and to honor a dedicated servant of the people. But there are weaknesses there. There is dangers there. There are dangers there. There's danger that we may create a legend in his own time that violates all of the rules. There's also a great temptation to become emotional on an occasion like this, particularly when you have a man of this kind, this many virtues. There's a great tendency to become emotional, and Paul, we might convert this into a eulogy while you're still walking around in a very, very active life. The 20th, 1983, as Dr. Paul C. Miltenberger Day. We acknowledge and respect your participation in both medical and community contributions. And at this time, I'd like to present this to Paul. And on behalf of the city of Kennett, I would like to present Paul with the key to the city. And to Margaret.
Dunklin County Memorial Hospital is seen from the front of Dr. Miltenberger's office. He begins his day each day between 7:30 and 8 o'clock, stepping over there for surgery. Then he makes rounds across the street for office hours, and then back in the afternoon to the hospital to make rounds again. That's a typical day. Long hours, but Dr. Paul Miltenberger doesn't seem to mind and hasn't minded all of these years.
I came to Kennett in 1949 in October after finishing a residency in general surgery in St. Louis. I had not been in any other practice except for my time in the Army, and I looked around the state for a good area to come to where a surgeon was needed. And I knew Dr. Peck here in Kennett, Missouri, and we were in medical school together, and we were close friends, and he kept advising me to come to Kennett and explained what a nice community Kennett was. At that time, Presnell Hospital was the only hospital open. And I met Dr. Wilson, who was a very fine gentleman and a doctor, and he offered me a position as surgeon at the Presnell Hospital. This was before the county hospital had opened up.
It's been my privilege, really, to work with him since we both started. We both started at the same time in practice here in Kennett in the latter part of 1949. At the old hospital, the old Presnell Hospital. That was before this one was built. And I've had the opportunity to observe Paul through all this time and be associated with him. And I can truly say that he is a remarkable and wonderful person.
He's a gentleman. He's gentle with his patients, and he's a gentleman to the world. Okay? He is a very excellent surgeon, and his biggest asset is his good clinical judgment.
The main thing about a hospital is its diagnostic capabilities. The diagnostic capabilities of our lab, run by Dr. Pooh, who is a pathologist and also a specialist, that the diagnostic capabilities are very excellent in the lab. And also we have our X-ray department with Dr. Manubay, who is the radiologist and specialist. Plus we have two pediatrician specialists, and Dr. Manubay, and our diagnosis now has a lot to do with radioactive material and also in what we call ultrasound. And I believe that for most general things that our hospital is very capable of handling.
was really biopsy proven also. If you want to get a clear detail about soft tissue too at the same time, adjacent to the bones, you could also get like when you're dealing with a lipoma.
As I'm giving the patient roughly about 10 to 15% kidney function. We'll wait until the patient enters end-stage disease at a level of less than 10% function before we consider putting them on.
Okay, all right. So when a patient is
because if they was to slip, we would get static on the EKG when it runs out over there while he's walking.
Proper preparation of the patient is absolutely essential to the correct running of the test. What these sensors do, the electrodes that they're pasting onto the patient's chest, they pick up the electrical signals from the heart and transmit it through these wires, as you will see, into the complexes that will play on the monitor as we do the treadmill. I'll be watching this monitor. We'll monitor everything else as we go along.
165.
Now, we never go the maximum heart rate. This has been worked out pretty well on the basis of age and height. We never go the maximum. We take them up to 85% of the maximum heart rate. In this boy's case, he's young and healthy.
You took nurse's training. Where'd you go through nurse's training?
Baptist Memorial in Memphis, Tennessee.
Okay, and were you an anesthetist when you came out?
No, I was just an RN, and then I went in the Navy, and I was in the Navy about 3 years.
Oh, really?
Right.
And you came back
here? Came back to Kennett, and that's where I've always been, or had been. And Preston Hospital was the only hospital here then.
So you began to work
I began to work there, and then, of course, I did the inevitable. I got married, and the other inevitable, I had a child.
Yeah.
And then the county hospital opened in 1951. So I went over there and was...
Did you work both places?
No, I quit and went over there.
Okay.
They didn't have a director of nurses, and they just needed RNs primarily, and just get it started.
Mm-hmm.
And I worked there for the rest of 1951. We opened in May. And we didn't have an anesthetist. Dr. Tarver used this mask that I've just shown you with the drop ether.
The ether mask. Dr. Tarver would use it.
Dr. Tarver would use it, yes.
All right.
Now, Dr. UAV Presnell, that had the Presnell Hospital, had given some anesthetics on a machine. But I wasn't here when he did, but he did, that's the only anesthesia they had then.
Well, they want to know what it is, the tissue they remove, whether or not the tissue is disease, or if so, what kind of disease it is. And of course, the layman probably are most interested whether or not there's a cancer or no cancer,
right.
Which is also a biggest part of the surgery nowadays. Is the removal of the tumor. Of course, there are a lot of other things.
All right. Could we just look over your shoulder while you do some of these routine things that have been brought in?
Yeah, I can show you all these.
What about Kennett at that time? What about the population and the hospital situation?
Well, I'd say the population was 6,000 to 7,000. Of course, the Presnell Hospital was the only hospital here. Dr. Presnell had established that in 1940.
So it was a new.
It was new, yes. Mm-hmm.
And did Kennett have several doctors at that time? How many do you recall?
Yes, there were 10 or 12. Of course, Dr. Baldwin, Dr. Dempsey, Dr. Kofer, Dr. Spence, Dr. Linton, Dr. Wilson, and Dr. Ryland Presnell, Dr. UAV Presnell.
So there were quite a few. We have a lot of questions that we really want to hit these gentlemen with, and I wish I knew all your questions as you were sitting in the audience, but surely yours are like mine. When I first heard of the sale of the hospital, there was all rage and indignation that we would do this. And from talking to other people, I feel like I'm fairly normal, that's a normal feeling. Now then, we have seen this through the hospital board and so forth. We have seen this all change to where actually it looks like the sale is going to be completed. And did I not read, Mr. Hawkins, that you have been just, there is a rough draft in Kennett of a second draft of the sale that you all are going over. Have you had a chance to look at this yet?
Just briefly. We were supposed to go over it this afternoon with our attorney.
Okay, and so you don't really know the contents of that as yet. All right, now just recently you three gentlemen have been all the way to California, just seen the sites, and among those sites, J.C., what were you really there for?
Basically, we went out to see a hospital that was owned by Safeco.
Safe Care. Yeah,
Safe Care. Safe Care and managed by Continental Health.
And that's who proposed to buy this hospital?
Right.
Okay, you went out to look to see what they had.
And what they were doing.
Okay, Mr. Gray, were you impressed?
Very much so.
How are we going to be better off to sell the hospital to a profit-making organization? Are we not going to be much greater burdened with costs? Okay, who wants to answer that? Okay.
Of course, there's nothing I can say is a guarantee, but you can rest assured that hospital costs will go up. Now, let me kind of look at this.
I mean, more than they would have gone up, were it still taxpayer-based.
Okay, we'll talk about that for just a minute.
Okay.
Okay, you talk about the taxpayer base. First place, the hospital has never funded depreciation. So consequently, and they have bought some equipment, and the building is in fair shape, but they do not have the money to bring the hospital up to standards.
Okay. That equipment-wise you're talking about.
Equipment-wise and building-wise. In other words, when it was built, there was very